Episode 85, The Paradox.
Welcome to The Paradox with your attending, Dr. Eric Larson. He is a practicing anesthesiologist and clinical assistant professor at Michigan State University College of Human Medicine. Listen in as he takes you behind the scenes of what practicing medicine in today's ever-changing world is like with another doctor. The Paradox is a fun and accidentally informative show for physicians, patients, or anyone who has ever found themselves in a waiting room.
Welcome to The Paradox. I'm your host, Dr. Eric Larson. Thank you for joining me as we explore the U.S. medical system in a fun, informative format through expert analysis. Today's going to be a special spring break edition. It's spring break here in Michigan. I had not anticipated putting anything out because I was not going to be in the country, but that has clearly changed. It was going to be my daughter's special graduation gift of some sorts from high school. It was our last spring break together, but coronavirus or COVID-19 has kind of ruined that. And it's ruined all kinds of people's plans and businesses, lives, careers, health, certainly for some people. So we're going to talk about that today. And specifically, we're going to focus on the nonsensical response to the coronavirus outbreak through government action. And I'm really upset about what's going on in Michigan. Michigan's not unique. It is a little bit different in the sense that Michigan has sort of two different outbreaks that are going on, and one that is and one that isn't. And so that's what we're going to discuss today. And I think it's important to look at the government response to what's going on. And again, Michigan is not unique in this sense. And I think I don't want to pick on anyone particularly, but I would say that our governor is handling this poorly. And I'm recording this as of April 10th, 2020. Clearly things change quickly with this whole coronavirus. It's from one week to the next. They're very fluid, as they say. But I want to talk about some of the bad science or people just not understanding what's going on. I was a nuclear engineer as my undergraduate degree at the University of Michigan. So I did lots of physics, lots of mathematics, obviously things related to radiation shielding, which is, how much stuff you need between you and the radioactive source, what the sort of radiation is, what the possibility from a health standpoint, what the danger is. Different particles have different penetrations through different substances. Some things cause more damage than others. So anyway, one of the principles of radiation, one of the basic ones, is called attenuation. And so this is basically the notion that the farther you get away from something, or the more substance you put between yourself and the radioactive source, the more protection you have, or the less exposure you get to the radiation. And this is actually, we're not going to talk about the substance, we're just going to assume we're in air, so there's nothing actually between you and whatever it is. And you'll hear this all the time if you're in the OR, or if you're, in the emergency department. They'll say, well, as long as you're 6 feet away, you're fine, right? And so universally 6 feet is used as this safety zone with radiation. And I mention that because you're hearing the exact same thing when it comes to coronavirus. There is this magical 6 foot zone where you are no longer at risk for contracting coronavirus. Much like if you're 6 feet from whatever radioactive source there is, you're not at risk for getting whatever it is, X-ray radiation that's going to be significant. Well, this is clearly false. If you look at an X-ray beam, we always imagine it as like a laser. And so the X-ray is shot, the radioactive particles travel in a straight line, the X-rays, but this is not the case. They what we call scatter. And so they move in all directions. They don't go backwards usually, although they can reflect off surfaces. They get attenuated by surfaces. So if you're standing behind a piece of paper, some of the X-rays are attenuated, not many. If you're standing behind a piece of lead, then most of the X-rays absorb and it actually does not penetrate. If you're behind, 18 feet of titanium and lead, then you'll get no exposure from the X-ray radiation. Well, the same can be said for coronavirus, right? So this is why the principle of if we're worried about aerosolized viruses, clearly if you're wearing a mask, the amount of coronavirus, the distance that it can actually travel is attenuated. Likewise, if there is no mask, why do we care about 6 feet? What is magical about 6 feet? There's nothing magical about it. But one of the principles of the engineering and for attenuation of whether it's a virus spreading out of someone's mouth, traveling through the air, or radiation, essentially we imagine it moves in a scattered sort of projectile, so it's concentrated right at the mouth. As you get farther away from the mouth, it sort of just dissipates. And so the amount of exposure you get is related to how close you are to the source. So why is it 6 feet? Well, it's because it's actually related to, if you look at it at a fraction, it's related to r squared. So as you get farther away from the distance, or d squared in this case, since you're not actually using a radius, since you're not worried about radiation from behind you, as you get farther away, it's the amount of radiation you get is reduced by the square. So what does that really mean? Well, it means if you're 2 feet away, you get 1/4, so 1/4. If you're 3 feet away, you get 1/9, or you get about 12%, of 11 to 12% of the potential exposure. 4 feet, 1/16. So what's magical about 6 feet? Nothing. It just means you're now at about 3% of what the exposure dose would be for radiation, or in this case, viral projectiles. Likewise, if you're 5 feet away, it's 1/25, or 4%. So there's really not anything special about 6 feet versus 5 feet versus even honestly 4 feet, except that the exposure level is a lot lower. So it doesn't make it zero. I mean, obviously, you're 1,000 feet from someone, the exposure would be essentially zero, 1 over like a millionth. So one of those virus particles could make it to you. But that's the whole thing with 6 feet. There's nothing magical about it. It's just a mathematical thing. But I don't want people to think that, if someone's 4 feet away, they're at like massive risks for things. And it's once you get out 6 feet, then, well, clearly, whatever it is can't survive that far. It's just simply a reflection of just math and d squared, or the 1 over d squared. So it's the inverse of the square. So that's where the whole 6 feet comes from, both whether you're in the OR. So if you're 4 feet from an X-ray machine when it fires, your exposure is 1/16 what it would be if you were, right at the source. So I don't know. I mean, it's more, but it's not like you're better off at 6. You're better off at 6, but it's not like there's something magical about the 6 feet distance that suddenly it like stops everything. So I don't know what that makes you feel, but I think, the 6 foot thing is touted by all these officials and people saying, make it like it's a magical thing. It's not, it's just math. So anyway, that's one thing. I just had to get that off my chest because the math thing has been bothering me for weeks now. So let's talk about the outbreak of coronavirus, and what I think is a very nonsensical response by the government. We've talked about in this program about the problems with the FDA and the CDC and their bungling of the testing, and the fact that they've limited, through regulatory reasons, why we've had a limitation on personal protective equipment, whether that's through tariffs or that's through general regulations that don't allow industrial uses for hospital uses. And so we cut our supply line really thin, and then even in an event of time when you need it in a crisis, you don't have access to it because of these regulatory burdens. And if you're someone who's manufacturing things, you're like, well, there's no point me trying to apply for the applications to produce these masks, because by the time I actually get my factory geared up to start producing them and the FDA actually approves it, the crisis will sort of be gone. The other masks that are being produced will sort of have caught up. There's no point to it. And so that's why we don't have a big, huge surge in supply either, in some ways, because quite frankly, it just doesn't make any economic sense to retool your factory to do this. If you're already doing it, you can maybe apply for extensions and things like that with the FDA or to get allowed to make more, which is crazy that you're actually only allowed to make a certain amount in some instances. But this is regulatory capture. This is what the industry likes. They like this way. It prevents any competitors from coming to the market. But all that aside, let's talk about the other problems that are going on with the virus and the response to it. The virus is a problem. It causes a huge surge in admissions, ICU usage. People get sick from it. Unlike the flu, they get sick for a longer period of time. They tend to be, those who require hospitalization get sicker. They tend to die a little bit more frequently, it seems, in the flu. I don't know that we're going to know really the numbers of everything until this is all done. And even then, it's going to be really hard to sort of parse out when you realize how unreliable lots of the statistics are as far as, classification of who died from what, because there's some question, if anyone dies of something suspicious of the flu, or of pneumonia, then you say, oh, they just died of coronavirus, when in fact, maybe that's what they died of. We don't know for sure. We never tested. It doesn't make sense to test someone who's dead because they're maybe 85 years old. They had other comorbidities, and you're like, well, they died of pneumonia. We'll just call it coronavirus because that's what's going on right now. That seems to be prevalent in the community. But there are a number of people who are dying of pneumonia all the time, and so they weren't getting coronavirus. So you can't say that everybody who now suddenly who's dying of pneumonia is coronavirus, if that makes sense. But that aside, the problem with this response is that we're not really having a response and restrictions that make any sense in relation to how we're going to try and control the virus or mitigate the spread. Right now, we can't contain it because we don't have any adequate testing. It's so prevalent in the community that there's no way of stopping it from coming. So it's already here, and so the goal is to prevent more people from getting it, to try and slow down the spread. You might have heard the term R naught. That basically means how many people on average are contracted from another person who has the virus. So I think it's like 1.34 to 2 people. So if you're one person, you get sick, you're going to spread it to 2 people. They spread it to 2 people, and suddenly you've spread it to 8 people, right? Because if those people just send it to, like if you go sort of like the 7 degrees of Kevin Bacon, right? If you go far enough out, if you double everything, it doesn't take long before you have a gigantic number. I mean, just try and take a piece of paper and fold it 20 times. You'll find that you're unable to do that. So in order to mitigate the spread of the virus and to change that R naught to a lower number so that the ability for you to infect someone else would be a lot less. It'd be maybe half a person. So one person only gets half a person infected, or so it takes 2 people to get 1 person infected. As you can imagine, now that the spread of the virus slows massively. And this is sort of like if you got a cold and you stayed home and you didn't go in. And in fact, everyone in your house got the cold. They all stayed home and they didn't go out and about until they got over it. Well, now you've changed your risk to giving it to other people to about 0 because you're not having contact with them. Now, maybe you were infectious right before you realized you had symptoms and you just didn't stay home. But anyway, the point is that you've changed the R naught. You've changed the ability to get other people sick, or the likelihood of getting other people sick. Now, the tricky thing with coronavirus, it certainly seems that there's asymptomatic spread, which means you can be sort of feeling fine or have minimal symptoms that you don't recognize. You're walking around, you're infectious, you get people sick for a couple days, and then you realize you're sick and you stay home. But at that point, some of the damage has already been done in the sense that you've gotten some other people sick. So if we think that's the case, then we want to prevent people from going out and about and getting other people sick. The number of 1.3 to 2 of R naught of how many people you get sick is entirely dependent on your behavior not changing. So the thing that's important is to say, well, if you know that there's something is present in the community that is potentially infectious that's going to spread, and you think, well, I'm at risk of spreading it or contracting it, I'm going to be careful about what I do. I'm not going to go to a bar and hang out. I'm not going to go to church maybe, or I'm going to, when I go out, maybe I'm going to wear a mask. I'm going to use Purell. I'm going to wash my hands 10 times more often than I used to. If those are the things that happen, then you have almost for sure changed that R naught from maybe as 1.5 to 2 to maybe 1 or less, just by your change in behavior and be more cognizant of what you could possibly be doing to other people or to your family or whatever. So likely with nothing being done, people change their behavior and the mitigation rate, or the mitigation increases in the sense that the spread slows just by the fact that people are aware of what's going on. And so you don't have to do anything, and just people's general behavior will change a little bit. Now, it's possible that that's not enough. Maybe this is so infectious or so deadly that even those methods aren't enough. And so you can tell kids all you want to blow your, when you blow your nose or sneeze in your sleeve and wash your hands all the time. But if you've seen little kids especially, I mean, their hygiene is not high on their list of priorities. And so it's not surprising that viruses spread very quickly in schools. You'll see strep throat, pink eye, lice, all kinds of things, right? That all happens in schools. The one nice thing about coronavirus in some ways is that it doesn't kill young children unless they are significantly immunocompromised or some sort of real problem for them, but which is unlike the flu even, which the flu is much more dangerous and deadly to children. But that aside, if you're worried about mitigation, if you're worried about the spread and you want to do mitigation techniques, it is not unreasonable to say we're going to close schools because that is a vector, means people who can spread the disease to other people, and kids spread everything. And so you send them home and they got it, that they give it to their friend, and they go to their house and they give their parents and their grandparents or whatever, and that's how it can spread and get through the community. Now some people say, well, it's actually safer having them at school rather than at home because the likelihood of them exposing other people is less at school because they're not around aside from teachers, they're not around adults, maybe people who are more vulnerable population are going to get sick from it. I don't know. I don't want to go into that discussion because I don't think I know, and I don't think anyone knows for sure what's the best technique. I don't think it's unreasonable for people to say we need to close the schools while we have this pandemic. This is assuming that the coronavirus is as bad as everyone says it is, which, if you see communities that are hit hard by it, without a doubt it is, because you're hitting everything all at once and stressing resources that in the communities. So there are mitigation techniques that I think are reasonable, like telling everyone to wear a mask, telling people to not stand up close to each other, not gather in large crowds. If you have something that's really dangerous, then these things make sense. And so when the government has dictates saying, don't do this, don't do that, and they include don't gather in large crowds, don't, maintain your social distance, wash your hands. These things are, I would say, reasonable things for a government to say. But the problem, of course, is that government sees everything as a square peg, and they have only a hammer, and they only have square holes. And so if you have anything that's round, the government's going to find a way to push it through or to write some arbitrary rules. And so what happens is the government is incapable of making nuanced rules. And this is, by its nature, it has to be that way, right? If you try and make a rule for everybody, well, you have to make a million rules if you have a million people. Because everyone has different circumstances. Everyone has different issues and problems and things they're trying to do. And so this is where the government gets in trouble, because they have to have a one-size-fits-all rule that makes it easily enforceable. And because of this, they can't have the nuance that's necessary. And I would point to our state of Michigan as an example. Most states are probably like this. They have urban areas and they have rural areas. The danger of the spread of a disease is probably directly related to the density of the population, how close people are together. A place like New York City, things are going to spread much more easily because everybody's right together and packed together in apartment buildings and on transit, down the sidewalk, in the restaurants, all over the place. Whereas if you're in a small town, you're not around many people very often. And so it's not to say that the disease can't make it to these small places, but the likelihood of it spreading and having that same rate of spread is entirely different based on your community. It's also probably related to communities. So that's why you see things like maybe Italy's worse from a cultural reason because they kiss each other as opposed to just shake hands, or, and maybe in other countries where they don't touch each other at all, they may have a lower spread. I don't know, but those things obviously make a difference. But if you have a state like Michigan, we have very rural areas, we've got suburban areas, we have urban areas. Well, the urban area is getting crushed, and that's Detroit. But outside of Detroit, it's not that bad. In fact, in the rural areas in the state, especially like the Upper Peninsula, which is, for those of you looking at a map, that's the one that's above the Great Lakes, there's many counties that don't have any reported cases. Now, you could say, well, there aren't any doing enough testing. That's probably valid. But the point of the matter is there just aren't a lot of people sick in the hospitals, flooding in the UP, and even in West Michigan, Southwest Michigan, in Northern Michigan, it's just not a huge problem. In fact, the problem is pretty much located in Southeast Michigan. So what would make more sense is to have restrictions and things that relate specifically to the areas that are affected, that are most severe. And so what would be a much more sensible thing is to say we're going to have regional differences or maybe countywide restrictions based on what's going on in our community. To have large swaths of land that are treated exactly the same when they have different risks doesn't make any sense. It's the easiest thing for the state to say, but there are other ways the state could respond. And the problem with this, of course, too, is that if you try and decide what is, from a business standpoint, what is essential and non-essential, it's impossible. There are some maybe you could say are obvious, like a nail salon is not essential. Now, of course, it's essential to the person working there. But for the people who are getting their nails done, do you have to get your nails done? Probably not. Do you have to get your hair cut? Probably not. There are probably some things you could say are pretty clearly non-essential. But when you try and figure out what is essential, well, certainly, let's say you got to have food, so you have to have grocery stores. You have to have people who can stock the shelves. You have to have people who deliver the food. You have to have people who grow the food. You have to have people who can service the grocery store when things break, like the air conditioning. People who clean the store. You have to have people who provide fuel for the store, people who drive the fuel back and forth, who work the gas stations. You have to have people who maintain the fleet. What if you have a flat tire? You have to have people who can fix tires still. What if a car breaks down? You have to have people who can fix the car. Well, what about the people who supply the parts? It's sort of like the iPencil. If you've never watched it, I'll actually link to that. But iPencil is a book written by Milton Friedman, just how to make a pencil. And the amount of millions of people who are involved in this sort of thing is pretty astronomical. It's pretty hard to imagine. It is actually amazing that it actually ever even happens in something that is totally uncoordinated. But that's beside the point. The point is that it's very difficult to figure out exactly who is essential and who is not essential. And this is where the problem comes in with these restrictions. Because if the restrictions are in place in order to prevent people from getting coronavirus and spreading it to others, and you say, well, we only want businesses that are important to be open, well, then let's say you think, well, no one needs to really mow the lawn. Okay, that's probably true, but is it really important to stop a person who's a solo operator, who's out on his lawnmower, just mowing grass, not within 2,000 feet of anybody, and cutting grass? Is that person someone you need to prevent from working? Or how about someone who's building something, doing roofing by him or herself, installing windows by themselves? There's no crew. Maybe they're trimming a tree. Are these people important to close down? I don't think so. And so this is where you have the real problem, because if your whole point is to prevent people from getting coronavirus and spreading it, well, stopping one person from walking around not near anybody doesn't make any sense why you would stop them from doing it. You have to, as a government, because for political reasons, right? Because if you allow that person to just go out and mow lawns, well, they have a competitive advantage over the commercial landscape crew that has to have 6 people, and they go from, through a neighborhood and they mow 10, 20 people's lawns or whatever. They're, shut down because they can't have a large crew. But the person has a solo operation, and that's their only source of income. Well, now they're just out of luck because their other competitors are unable to work. And so it's not fair to have them work and not the competitors. And of course, if you're looking from a lobbying perspective, obviously the large companies that have lots of crews are going to have better lobbying. So they're going to say, well, if we can't work, no one else should be able to work either. Likewise, the same goes for just about anybody who's working by themselves. It doesn't make any sense from a epidemiological stance that these people should not be able to work. And the more people you have out of work and forcing to stay idle, the more social problems and economic problems you're going to have for this country. And that's going to cause massive health problems, significant issues, obviously, with nutrition status. People can't buy food. They can't buy the same types of foods. And you're going to have real problems in just commerce. And these have real world effects on people, mental health issues, all sorts of things. And so it's not something that just can be waved away and say, well, they're just not essential. It's not important to get your lawn cut. Well, I agree. If your grass gets long, it's not the end of the world. But the point is, there's no point in stopping that from happening. Likewise, many of these rules, like you can't drive around town and, go to someone's driveway and wish them a happy birthday, but never get out of your car. Well, why not? That doesn't make any sense. You're at no risk of spreading the disease. There's no reason we don't live in a totalitarian state, which it's starting to feel more and more like. And if your goal with these orders are to keep people healthy, then preventing people from getting out of their house and doing things when they are completely without any contact with any other human being outside of their own household makes no sense. It's the arbitrary nature of government. It's a real problem. And you see this then you see problems with, like, you can't open a greenhouse. Well, probably common in Michigan, and I know lots of other places, you have these superstores, like, a grocery store, even Target, which sells groceries and sells other stuff. Well, now you say we don't want anyone going outside. We have stay-at-home orders, so don't go out unless you have to get groceries, because you have to have food. You have to have, whatever, gas to get places, but you have to have food, right? So you can go into the store and buy groceries, but you can't buy anything else. And so you go to those stores and, like, well, they also sell, potting soil and seeds or furniture, toys. And now you say, well, we don't want any people even going out for that, so we're just going to, Target, you can stay open, but you have to stay open just for groceries or whatever. You have to, like, cordon off the entire store. It's totally insane. It doesn't make any sense, just because from a fairness standpoint, just because you shut down greenhouses doesn't mean you can shut down these grocery stores. And they realize this, but there's no other way around it except to just have these arbitrary rules, like shutting down other commerce within that same store. It causes a lot of economic anguish. And I would just point to what's happened with our governor now. We're going to specifically focus on Michigan. Yesterday, April 9th, our governor extended our stay-at-home orders through the end of April. It was originally going to expire, I think, on Tuesday, the 13th. And this is not an indictment against her because she's a Democrat or any sort of political reasons. I think, well, there are plenty of political reasons you do this sort of thing. But I think the officials really enjoy having this power to tell people what to do, because for them, there's very little cost. She's getting a check, and all the legislators, and, I would argue that they're non-essential. Whether people are passing laws or not, it doesn't make any difference. It's not going to change anyone's life. Whether these people are totally non-essential, yet they're getting paychecks and they're continuing to work. And so she's getting her hair done, I'm sure. I'm sure she's getting, hair dyed and whatever, all the other stuff that none of us regular people are allowed to do. And this is causing real problems for real people. You can say, well, we'll just give unemployment benefits or whatever, but that is going to be a real problem, because you now are going to have businesses that are going to go out of business completely. There are already ones in my area that are restaurants that are permanently closing, and I'm sure plenty of other things that are closing I'm just not aware of, because they can't sustain 2 months without any income. I think, you look at physicians' offices and things like that, serious problem. But not only did she extend the orders through the end of the month, which, okay, you do that, but it became even more restrictive and even worse. And so we now can't travel between residences within the house. So if you have a cottage, you're not allowed to travel within the cottage. It's, I guess, breaking the law. You get arrested. You can't advertise property or gardening materials or anything that's non-medical or food related. I don't even know how they're going to enforce this. Are they going to tear down billboards? Are they going to, I don't even know what the thinking is of the state that you can issue an executive order and just ban advertising. You can't sell carpet. You can't sell flooring. You can't sell furniture. You can't sell paint. You can't go to vacation rentals. You can't rent anything, obviously. All travel is essentially prohibited unless it's deemed essential. I don't know how you enforce this. I'm not exactly sure what the danger is for me just driving around town. Now, if I say I'm going to go exercise or go to walk, you're allowed to do that as long as you maintain social distancing, etc. But these laws and these rules are in place have no bearing on protecting people. I mean, you could argue that you don't want people going to get flooring, I suppose, but I don't know. I don't understand, if you have all these other protections in place, maintain social distancing, wear a mask, wash your hands, how these things are a direct threat to anybody. And the fact that tree trimmers, landscapers, builders, garden centers can't be open. None of this makes any sense. There's actually a question on whether you can even use a motorboat. So I could go out on a lake. Now, it's April in Michigan. Not a lot of people are out on boats. But let's say you go on a boat. That if you're just tooling around the lake in your boat with your family, that's suddenly like a violation and that's a danger, a threat to somebody? It doesn't make any sense. It's crazy. Now, it's ambiguous, not surprisingly, that there's one statement on the state website that says you can, one says you can't. The one says you can if you're like a canoe or paddle boat or something, as long as it's physical activity, because they don't want to say you can't go out and do anything, because they don't want people to, because you got to exercise and not gain 50 pounds while you're in. We already have an obesity problem in this country, and certainly in this state. They also have restriction on how many people can go in a store. So if it's a over 50,000 square foot store, only 4 people can be allowed per 1,000 square feet, or only 25% of the maximum capacity at a fire marshal, and that includes employees. I don't know how many people are in a typical Meijer. I guess a typical Meijer is about 200,000 square feet. So I don't know if you're allowing just 800 total people. I'm assuming there are 100 employees at least in a Meijer. So 700 people outside. I'm not sure what the capacities of a Meijer store is, but my guess is that's going to cause some real problems. And I don't know, maybe we'll get real bread lines. Maybe we'll have, so much restrictions in getting food. We're spending time lining up outside, maybe in the rain, in bad weather. It's like, this does very much feel to me like we're trying to turn ourselves into Venezuela. And this is a real problem, and especially when there's no science behind what's being done with these orders that are being issued. I mean, not being able to advertise VRBOs, it doesn't make any sense. Why can't I advertise vacation rentals? I mean, I don't have one, but it's like there doesn't seem to be any sort of rhyme or reason to why that exists. Now, our governor was very kind in saying that the Easter Bunny is still allowed to come. But these are the sort of the silly things that are going on. These are political games being played. And these are people's real lives are at stake. I have someone who's working on a deck at my house, and he's, basically going to go bankrupt. I mean, I can forward him some money ahead of time, but he's not allowed to work, and he's just one person. I'm sure he's one of thousands, if not tens or hundreds of thousands of stories across our state and, the country. Those stories are everywhere, I'm sure. There are real people who are going to be struggling to find ways to make ends meet. And so you cannot just look at the health implications of what's going on. You have to look at the economic implications, which absolutely have health implications in and of themselves. And so I recognize the threat to people for the spread of the virus, but we also have to take into account what we're doing, why we're doing it. And I just don't think that's being done right now in the sort of hypersensitive principle of just being safe, without recognizing the other hidden costs of what we're doing and turning this into again, it feels much like a totalitarian state that you're going to have to start driving with your papers, especially for something that's this order that's lasting as long as it is. And in other places, I think in Virginia, it's going to last into June. It's totally insane. Now, the governor said that she'll reverse things if she sees signs of there's no clear statement of when, but just that she's monitoring the data in the state on infection rates and the spread, whether there's sufficient personnel, beds, ventilators exist, the availability of personal protection equipment, PPE for health workers, the state's capacity to test for COVID, and the ability to isolate people, and the economic conditions. That's number 5 on the list. This is inadequate. This is not any sort of plan. There should be set goals in what you have. And so if I were governor, what would I do? Because I think this is important to think about what it is that we're looking to accomplish. And our sole focus here is to prevent the spread of the disease without destroying our citizens. That includes, their health, but also their economic well-being, which essentially is also their health. One of the reasons we're so healthy, yes, we've got all kinds of comorbidities with obesity and diabetes stuff, but our prosperity is one of our greatest strengths. It allows us to adapt very quickly to problems. We have shortages of things, and we can get them relatively quickly if it weren't for lots of the regulatory burdens in the way. But we have manufacturers who can re-gear and retool for things if we need it in a crunch. And so that's one of our great strengths in this as a country, our great wealth. So if I were governor, number 1, I would allow counties to establish guidelines for shutdown of businesses. I think a county by county, maybe even regionally, counties can talk to each other. You can have a West Central Michigan or Central Michigan, Southwest Michigan. These areas can sort of decide on them for themselves what they want to do and what they think they should do as far as shutting down commerce and restrictions, because they're unique. They're not Detroit, just as Detroit probably could have more draconian shutdowns because the disease is much worse there. And, counties can make that decision. But I think the state can provide guidance. It can provide data. It can provide all the advice and recommendations and things to be safe. And that's, I think, the role of the larger state in this situation. You can rely on the federal government if you want for guidelines as well, like following CDC guidelines, which has totally failed in general, especially when it comes to the masks. But essentially, you allow communities to decide for themselves what they think is best. And I think that's important. And they can make the restrictions whatever they want. They can prevent other people from coming in and, using their businesses. Like only people from our county can use our restaurant or whatever, and make those restrictions. And then you can ease them up much easier at a local level than you can, and make it more nuanced for your local locality to sort of match what the problem is, as opposed to having broad sweeping generalities as laws. That's why it's much better having state laws versus federal laws, but it'd be much better having local, county, or even community laws if you can, just to help mitigate the spread of things. Number 2, you have to establish some clear goals and an exit plan. So this means you have to say, okay, so we are going to, once we see a certain death rate coming down, or we're going to have significant testing, and once we see there's a certain immunity level that's reached, or people who've had the disease, then we're going to start easing up restrictions because we know that the spread will be a lot lower. And I don't care how you do this, but you have to establish something, whether it's cases, deaths, testing parameters, something. But you have to have something so that people know ahead of time where we're going. So often we have policies that are designed that say we're just going to do X, Y, or Z, and there's no endpoint. There's no idea what, whether we're getting close, whether we're getting farther away, what we're doing. That's sort of how most policy is developed. You certainly look at foreign policy. That definitely is how it is, right? We're just going to go into Afghanistan and just fix things. Well, that's, so ambiguous. Or go into Iraq and fix things. Well, how do you know when it's fixed? Well, you can change the mission a million times, but if you don't have a clear objective, you really can't ever win. And giving people that much power over to regulate your life is really a bad idea. It's something I think generally Americans are not for. Number 3, you have to establish that mitigation, of the disease, is the only goal. So we're not having political reasons of like saying, well, we're going to let this person stay open, not the person, because they're a big business or a little business. It's just like, if this is someone that is at risk for spreading things worse, then we shut that down. If it's not, then it doesn't make any sense to have them close down. Why couldn't you have a large business say, we're going to all take, all landscapers, and we're all just going to make sure we work in teams of one? And it takes longer to do a lawn, and maybe it's not as efficient, but we can do it that way, just like the little guy can do it. I think these are things that people could work out rather than just saying, yeah, nobody can do it. And the people who are at no risk of spreading the disease to anybody, where they're not, within sight of anybody, except maybe through a window, that they're at risk of something. So I think that would be the only goal that should be with the rules writing, that at least when you're trying to figure out the things that people have to do, that should be the only goal. Number 4, you should make recommendations. Masks, limit travel, hand washing. I think they're recommendations, but they're not ones that should be, throwing people in jail. Because essentially that's what it is, right? I mean, if you're going to prevent someone from being on their motorboat, it doesn't make any sense. It's crazy. You're going to throw them in jail because they're out like just on a joyride on the lake? They're no threat to anybody. They couldn't even probably get a seagull sick because the seagull won't get within 6 feet of them. So you could limit social gathering. I think that's a reasonable thing to do. And I think those would be best established through local, to get a feel for what the disease level is in your community. There shouldn't be arbitrary rules. Like, why are there restrictions to advertising? That doesn't make any sense at all. Whether you advertise your tile company or whether you're selling your carpet sale, that has no bearing on whether people are going to get coronavirus. And that's just dumb. Shouldn't have restrictions, and you shouldn't cordon off aisles in stores and those sorts of things. Again, goes along with mitigation has to be your only goal. For those who are vulnerable, tell them that they're vulnerable and to be very careful. It's much more sensible to have people who are elderly, people with diseases, to have other people go get things for them, clean them off, do whatever they can, and just prevent them from getting out in the community, and having other people sort of return to work and have more of a normal life, and just avoid those people and just have them say, that's just because you can't make everybody stay home because there are a couple people who are more at risk. Yes, anybody can get coronavirus. Yes, people can get really sick from it. I totally understand that. But it also, again, there's a trade-off here, and you have to be reasonable about what you're doing. And I think the other thing, the last thing, is probably one that's very important, which I'm sure won't get done, but needs to get done. I think you just need to relook at the regulatory framework you have within your state. I know in the state of Michigan, I've had episodes we talked about this before with the certificate of need laws. There are lots of these restrictions into how many hospital beds we have, how many imaging services we have, laboratory services. These things are restricted by arbitrary boards that are generally made up of the actual people who are the competitors in the market. So you want to open a new hospital? Well, you have to get approval from the hospital board. And guess who sits on that? Your competitors or your future competitors, other hospitals. Well, they're not going to be too keen on you opening a hospital and competing against them. So they don't want those beds. So what happens? We have less of this stuff. We have less choices, less competition, and less ability for when you get some crazy thing like this happen, there's less capacity within the system to deal with things. Those are state levels. Federal, obviously, you look at more things with the FDA regulations as far as laboratory testing, the masks, production, all the different things in healthcare. It's so hyper-regulated, much like the financial services. It is really hard to get anything done, except unless you're a massively large firm. And so it's really tough to be competitive against other countries like China. And so you're going to rely on outsourcing out of the country because you make it too difficult to do business within this country. So, but that's a federal thing. But as a state, if you're a governor, I think you would clearly look at that, or a state legislator, you clearly look at these regulatory problems and to try and fix things. Well, I hope you're having a good spring break if it's spring break for you. If it's not, I hope you're having a nice spring and If you're somebody who celebrates Passover or Easter, you're having good holidays as best you can with close friends and family. I know I'm going to come down off my wall here in a little bit and cool off, but these things really get me fired up because I really feel like we're no longer living in America. I understand the problem. I don't minimize the threat to life and health for a lot of people, for healthcare workers who are provided really inadequate supplies through their hospitals. We do not have that problem. My hospital, I think it's been very good. I mean, we have not really had much as far as a surge of patients. We have some. We prepared for it and really haven't had much. And so it's almost like, I think it was smart to be prepared, but it just never happened. And so now maybe it will in the future. I don't know. But my hunch is we're kind of probably past the worst of it. And again, this may not evergreen well, but my expectation is that this is not going to be as bad as everyone thought it was going to be, at least in our community. That's not always the case for every community, and I totally understand that. And I think those communities should approach this problem differently than having a blanket response by every community everywhere. So anyway, that being said, be safe, stay healthy. Remember that 6 feet is nothing magical. It's just distance squared, 1 over distance squared. So you get a 1/36th the dose. But after you're done with this episode, please go to your podcast player, leave a 5-star rating, share it with a friend, and we'll talk again. Bye.
Thanks for listening to The Paradox. If you like what the doc is doing, please subscribe and leave a review on iTunes or Stitcher. And share the show with your friends. Become a supporting listener to get access to special bonuses at patreon.com/theparadox. Show notes can be found at theparadox.com.